The Department of Health, BRICS Business Council, the Africa Centre for Disease Control and the Prevention of Africa Health Business are a partner in a leadership dialogue on pandemic preparedness, prevention and response for health security. The forum, to be held today on the margins of the 15th BRICS Summit, seeks to fuel research, development, intervention manufacturing, information sharing and resource allocation, engaging both the public and the private sectors to bolster health security in the Global South. For more on this, let's now cross back to Sakina Kamwendo at the Sandton Convention Centre. Now, a very good morning to you, Sakina. Thank you so much for joining us. I suppose it's a jam-packed program today, isn't it?
Well, it certainly is, Simpiwe, and of course, starting bright and early, we caught you up on some of the developments overnight on the international front, and of course, many of the discussions happening on the sidelines, which also bear, huge importance that we are trying to reflect on, and I suppose none as important as the health discussions, because we know how devastating COVID-19 was. And I'm joined now by our Minister of Health, Dr. Joe Phaahla, as well as the longest-serving member of the BRICS Business Council, and also he is with Aspen. That's Mr. Stavros Nicolaou. Thanks so much, gentlemen, for joining us here in studio and for a very important discussion. But I want to start by just getting a response, I suppose, at this stage, Minister and Stavros, to a landmark ruling by the High Court last week. We spoke to the Health Justice Initiative on Monday about that ruling, about government having to disclose the documentation around procurement and other negotiations around the COVID-19 procurement. So we were told the Health Department was still studying the judgment. What is your response at this stage, Minister?
Well, thank you very much for having us this morning. To start with, it was never our intention to hide the information in terms of what the vaccines cost, but it's in the nature of the contracts of our ability to access those very life-saving vaccines. Because of the business nature, I think Stavros will be much more familiar with those kind of issues, non-disclosure agreements, because amongst the manufacturers, the suppliers, there is a lot of business information. So as a public institution, as government, we have to report to Parliament, we have to report to the Auditor General. So those kind of issues were just also very difficult. So the reason why we have to agree to that is because of the contractual nature of, for us to be able to access those vaccines. So even now, with that court ruling, we have to be guided by our legal advisors in terms of, what is the best way, and also engage the other partners. I mean, the contract is between, two entities. So we have to, once we've got the ruling, we have to get back to the drawing board to say this is the situation. And as I say, from our side, because we use public funds, we always have to report. And
it is, of course, in the public interest. The ruling, by the way, compels you to make that information available, Minister. So I know you said, your department said you're studying it. As you say now, you're still consulting with other stakeholders. But do you intend bringing, an appeal to this particular?
We haven't made that decision. That's why I'm saying we have to be guided, because, as I said, it was never really a matter of principle for us, but it was a matter of the requirements of the other partners in our ability then to be able to access these very life-saving products. So we have to engage and get proper, we're busy with that consultation with our legal people and also with the other side, so that we can make a decision. for us it will be the easiest to comply.
So it would be people like Stavros Nicolaou who might prevent you from, moving as speedily in making sure that that information sees the light of day. Stavros, your reaction to this, because you would be one of the big players in this particular space.
Sakina, we actually not involved, funny enough, because we never ever signed a contract with the Department of Health as Aspen. So I'm putting my Aspen hat on now to respond to this particular question. Aspen produced the Johnson & Johnson vaccine on behalf of Johnson & Johnson. So Johnson & Johnson, Pfizer, and anybody else signed agreements directly with the Department of Health. Now, firstly, I support transparency, because I think if you, as the Minister says, if you're using public funds, the public is deserving of critical information. I don't mean that you must drill down into the competitive issues of a contract, because these are competing companies, but certainly some of the major disclosures that are in the best public interest, I believe, need to be transparent, and the Minister is saying the same thing, right? But I think he's also saying that when you sign these agreements with these companies, and just to stress, there was no agreement signed with Aspen, right? When you sign these agreements, these are two parties involved. Now, if the one party is insisting on certain non-disclosures, and you're in the midst of a pandemic crisis, it doesn't leave the health department much leverage, right? So that's the issue here.
And I think it's a very important question, and I'm glad we started there, because what we're going to talk about now, as per what's happening at BRICS, is preparedness for future pandemics. And we know that it will happen. At this point, we know that it's more predictable. So we could see another situation, perhaps not as devastating, who knows? We can't tell what the effect of it will be, but how prepared are we going forward, and what are some of the lessons that we've learned from COVID-19, Minister?
We are making sure that we're better prepared, and that's why we're having a session later today as part of side events, just at various fora. First of all, as the South African, government, and working with our partners, you would know that part of the very important lessons of the COVID-19, response was that government can't succeed alone. We had to create, all these partnerships, and thanks to Business for South Africa, which came really very handy in terms of assisting government at various levels. So we want to make sure that, first of all, as governments and here as the BRICS countries, we work together at all levels in terms of surveillance information, in terms of our top specialists, epidemiologists, our virologists, that they share the information in all the surveillance which they are doing, but also in terms of the key necessities, your diagnostics, your vaccines themselves, and the preparedness of the health system overall. In various forums in which we are participating, we are making sure that we always check, how well prepared are we. So this is also what we will be doing under the BRICS Summit today.
Stavros Nicolaou, I mean, it is almost mind-boggling. In fact, it is mind-boggling to think that we only produce on the African continent 1% of all the vaccines that we actually use. So what have we learned, and how has COVID better prepared us to firstly deal and produce our own vaccines, and also to make sure that the continent itself is more self-sufficient, so that we don't get left behind and have to struggle with issues such as vaccine equity for the next pandemic?
Firstly, we learned many important lessons during COVID. One of the hardest lessons, I believe, is when a pandemic breaks out of this nature, and we will have other pandemics, In fact, we should rather say we are in a pre-pandemic phase now. Okay, we shouldn't say, well, there might be another one at a future date. If you're not in that mindset of being in pre-pandemic, you're not going to be ready at the time. Okay. So one of the hardest lessons was the world said it would act in solidarity. There would be equality, vaccine and other medicine countermeasures, but that could not have been further removed from the truth. So you have to have your own capabilities and capacities, and that is what our government has been advocating now. So the key here is, so we're not caught short next time, we have to have our own capacities and capabilities across medical devices, diagnostics, vaccines, and medicine countermeasures, all of those. But more importantly, these capacities have to be sustainable. And that for me is the single biggest factor to take into account, excuse me, for the future, is it's no use putting up these facilities on the African continent unless we can sustain them. If we cannot sustain them, they shut down in 2 years' time, and then the next pandemic comes to the fore and we don't have the capacity and we're scrambling again.
But why can't we sustain them? Because surely we also need, because we have to import, we have to buy from elsewhere 99% of what our needs are. So why wouldn't it be sustainable?
So one of the most important things we need to do as a country, as a continent, as a global community, we have to reform the global procurement rules for vaccines. Because right now, the international and multilateral agencies that are procuring vaccines are not doing so from African companies and or African countries. And that is why the 1% statistic holds true, unfortunately, at the moment. Now, there are some moves afoot to reform the procurement rules of Gavi, which is the Global Vaccine Alliance, of UNICEF, and even Africa in itself, headed by our own government and Africa CDC, are looking at a pooled procurement mechanism for Africa, so that we can start buying from Africa for Africans.
And that was set up, the Africa Epidemics Fund, February last year. But how far have we come, Minister? You know, what are some of the impediments to that particular process?
Well, there has been progress, as Stavros is saying. I mean, just over 2 weeks ago, we were visited by the DG of Africa CDC, and amongst the reports which he gave us was that with an engagement with the Global Alliance for Vaccines, Gavi, there has been a commitment now to make sure that a significant number of doses of vaccines will be purchased from African continent. And even considering the fact that our manufacturing is still in its early stage, so our costs are going to be higher. So Gavi has agreed on the fact that in purchasing from the emerging, manufacturers in the African continent, there will be some kind of a premium. So because part of what comes in, it's a question of price competition. So and that if Gavi can stay with that commitment, for instance, as a major purchaser globally, of saying that buying from emerging manufacturers, we will accept the fact that there will be a kind of a premium because they must still build the capacity. That will take us a long way in terms of the sustainability. So those are some of the negotiations, and I must say thanks to our president when he was leading in the AU at the outbreak of the COVID pandemic, because he led many of those interventions, and at least there is a light at the end of the tunnel now.
Well, that's where we're going to have to leave it for today, but we'll keep an eye on the engagements this afternoon, and hopefully we'll catch up with both of you again just to find out how things are moving. Our Health Minister, Dr. Joe Phaahla, there, as well as BRICS Business Council member and Senior Executive at Aspen Holdings, Stavros Nicolaou, speaking to us about vaccine preparedness. And of course, this is a big one, knowing that the next pandemic is probably just across the horizon.